government certainly seems to like Medicare Advantage plans. So we're going to talk about that today. When you sign up for Original Medicare at 65, or after you stop receiving health insurance from work, or you receive disability after 24 months, you sign up for Original Medicare Part A, Part B. There's a lot of gaps there. If you got a whole bunch of money, then you're good. But if not, a lot of people get either a Medicare supplement plan, those are the plan N, G, F, or you get a Medicare Advantage plan. If you're a regular viewer to my channel, you know that I always recommend checking out Medicare supplement plans first, but it really depends on your particular situation. They're good for some people and maybe not so good for other people. It really depends on your budget and all the rest of it. So let's talk about that today. How are they pushing people leaning towards Medicare Advantage? If you've ever watched Dr. Oz, his TV show, you know that he used to have Medicare Advantage companies come into his TV show and talk about Medicare Advantage. So he's been a big fan of Medicare Advantage since day one, I guess. And he has also floated the idea of Medicare for all. So having a single payer universal system, and his would be kind of a Medicare Advantage for all type of situation. That's one of his proposals, okay? There's also a bill in Congress that is talking about making Medicare Advantage the default. So when you sign up for Original Medicare Part A and Part B, you don't get that. You sign up for actually Medicare Advantage. And that is a bill, but we all know what a bill is, right? Us from the 70s know what a bill is. A bill is just a bill. It's not a law yet. So if you think everybody should automatically be signed up for a Medicare Advantage plan, then go ahead and support the bill. If you don't, then maybe you should contact your congresspeople and say, hey, not so fast. We'd like to have the options. And Medicare Advantage plans, I've got a lot of regular viewers here that love their Medicare Advantage plans. I've already got some questions and some comments here about people, they love it. Some people hate it. So, but at least with other options, you have other options. You have a Medicare supplement plan and stay with Original Medicare or Medicare Advantage. But it seems like the government is kind of pushing people to that other side. So there's the default, Dr. Oz. I just did a video a couple of 3 days ago that they're starting prior authorizations in test states. There's 6 states that they're attempting to start prior authorizations with Original Medicare. That's one of the reasons people stay with Original Medicare, is because they didn't have prior authorizations. That means if the doctor says you need whatever procedure, then some insurance company bean counter doesn't get involved in there. It's between you and your doctor. That's why people like the Original Medicare and then getting a Medicare supplement plan. But now they're introducing prior authorizations to Original Medicare, which is pretty much the first time they've ever done that. But again, this is a test case. It's going to start, I think, January next year, if everything goes as planned. And 6 states, and there's about 17 different types of programs, and they're doing it based on, again, that cover all. Anytime they say fraud, waste, and abuse, it seems like we, as the American people, allow the politicians to do whatever they want, as long as they say fraud, waste, and abuse. So that's what they're using to bring in these prior authorizations. Okay, so in terms of Medicare Advantage plans, why is there such a push to get you on a Medicare Advantage plan and not stay on Original Medicare? Even though people say, well, it's cheaper. Well, it's cheaper for you. If you get a Medicare supplement plan, you still have to pay your Part B premium, the $185. And then for a Medicare supplement, there's a premium for that. So you have to pay your Medicare supplement premium. And then Part D, the prescription drug plan, doesn't come automatically. So you have to pay for that as well. So you've got 3 different costs there, okay? If you get a Medicare Advantage plan, then you still have to pay the $185, but a lot of those plans are 0 premium per month. A lot of Medicare Advantage plans, 0 premium, not free because you're paying for them, but it's 0 premium per month. And the Part D plan, it's wrapped in there. So you don't have to pay for the Part D plan separately as well. So you figure, okay, that's cheaper for you, but it's not cheaper for us, for the government, for we. because Medicare Advantage plans cost us about 4 to 8% more per person in healthcare costs. And because if you've got original Medicare, the government pays, let's say, 80% of your Part B, surgeries and stuff like that. They pay 80%. So they still have to pay 80%. But if you have a Medicare Advantage plan, they pay more. Basically, what happens is the government pays Medicare Advantage plans. When you sign up for a Medicare Advantage plan, then that company goes to Washington and says, hey, we just signed up Nancy or Dory or Barbara, and give us that person's money. And that's what they do. They give that company, I think it was last year, is about $15,000 on average. So if you go to the doctor once a year and that you get charged $100, $200, the insurance company just made a $14,000 plus profit off of you. So it costs a lot more money to put people in Medicare Advantage plans. But the government, even though it costs more money, the government, our politicians like it because one of the reasons is it outsources problems. You are no longer part of a government Medicare Part A, Part B program. You're in a private insurance company with whatever insurance company you choose. So they kind of, the government's problems are outsourced to these private companies. And people like them. There's a lot of people that love. I've got a lot of regular viewers here love their Medicare Advantage plans, and more power to them. If you like it, if it's good for you, then it's good for you. Just have to check it, quite every year because they change every year. But people like them, and politicians don't want to mess with things that people like because politicians are all about getting reelected, right? So, and it's always about follow the money. Massive profits in these Medicare Advantage plans. And because there's massive profits, there's obviously massive lobbying. So these health insurance companies send their lobbyists to Washington to make sure they continue to get these massive profits. Politicians, another reason politicians like them is because they're easy to budget. When you're looking at original Medicare, the prices go up and go down depending on how many people use the hospital or doctors or getting old or whatever the case may be. So the costs fluctuate. With Medicare Advantage plans, you always know, okay, you've got X amount of people signed up. Here's how much we pay every year to these Medicare Advantage plans. It's easy to budget. So just laziness, I guess. And as anything else with the government, there's a revolving door. Once a politician or some, politician's assistant leaves the government, they often go work for that Medicare Advantage company, and we see a revolving door. So they continue to support Medicare Advantage plans. And again, that's what you like. That's what you like. More power to you. But it's nice to have options, and it's also nice to know why a lot of people are being pushed into Medicare Advantage plans by the government. Okay, I went through that relatively quickly, so we can get into as many questions as possible. All right, so we got Barbara, who is a member. Will we be required to fill up our Medicare Advantage plans, give up our Medicare Advantage plans? These Advantage programs don't accept my doctors, etc. We're going to be in trouble. These programs try to get out of everything. Yeah, that's one of the reasons, people that sign up for a Medicare Advantage plan and at zero premium, they love it until they don't, until they actually have to see something and their network starts to diminish. And I'm going to be doing a video probably tomorrow on that fact. A major U.S. health insurance company just said they're going to be canceling about 600,000 people from Medicare Advantage.